On the rebound Central Coast, as almost half of all COVID-19 deaths in California are tied to nursing and assisted care living facilities. Getting information about what's happening inside each facility can be complicated. Reporter Adam Rakusin uncovered what's happening on the ground in counties across the state.
The virus preys on the elderly, attacking folks with underlying health issues. Nearly half of all COVID-19 deaths in the state can be traced back to nursing homes and assisted care facilities.
They're saying that, the most affected are the seniors, in nursing homes.
Margie Schroeder's mom is a resident at La Vida Real in San Diego County.
I have to go online and research and find out what's going on there on my own.
With the number of cases in community and congregate settings rising, many families say they're struggling to get accurate information about what's happening in some facilities. Here's why. The state keeps public lists of facilities with positive cases and deaths, but if the numbers are under 11, they don't give an exact total. If you try to check those numbers locally, it depends on your county and what information they'll disclose. We checked with several counties in the state to see how information varies. Los Angeles County provides a list outlining all facilities and their total number of cases and deaths. In San Diego County, the county won't release a public list, but will give information on the total number of cases and deaths in facilities. Both Santa Barbara and San Luis Obispo counties provided total numbers on cases and deaths. Kern County provided a list of locations including positive cases and deaths. State records show a facility in Kern County with more than 100 positive cases.
If there was a dangerous hotel, a dangerous school that people should stay away from or be wary of if they have loved ones in those facilities, the counties would tell us. Why should it be any different in long-term care facilities?
Mike Dark is an attorney with California Advocates for Nursing Home Reform. He says the state is seeing the start of what is a staggering crisis.
Ask whether routine testing of residents and healthcare workers has begun. Until we get there, people will continue to be at grave risk.
Earlier this week, President Trump was asked if he's considered mandating tests of all nursing home residents.
Well, I would certainly consider that. I will mandate it if you'd like. I think it's important to do.
Margie says she checks the state's list weekly. With California starting to reopen, she worries
they're going to go back into my mother's room. I just don't know if it's, I just don't believe anybody anymore.
Adam Rakusin, KSBY News.
A spokesperson for La Vida Real said in part, "We have acquired COVID-19 testing kits and have been able to proactively and strategically test and contact trace both residents and staff." This week, the California Department of Public Health required the facilities to implement a plan to get all staff and residents tested for coronavirus.